everyone, I'm Anise, this is Greek Code, and today I'm doing part 2 of my medication series. If you missed part 1, click here. It's basically all about what situations you may consider taking medication for OCD, as well as some of the myths surrounding taking medication for mental illness. And today, in part 2, I'm going to be talking about what to expect from taking an SSRI for the first time. SSRI stands for Selective Serotonin Reuptake Inhibitor, and they're a type of antidepressant which are commonly prescribed to treat depression as well as a few other conditions, and it has been found that at higher doses it is very effective for OCD. Therefore, even if you don't have OCD but you're considering taking an antidepressant for some other reason, then this video could be helpful for you as well. You can only obtain SSRIs if you've been prescribed them by your GP or psychiatrist, basically a trained professional who knows and understands what you're going through. It will be their job to check first of all that they're a suitable choice for you. That is, they will check you've not got any other conditions or taking other medications or are pregnant, anything that could interact with taking the SSRIs. I certainly recommend having frequent appointments with your doctor, maybe weekly, maybe even more frequently, until you're stabilised on the medication when you start taking it, because as I will describe ahead, the ride for starting SSRIs can be a bit rocky. That said, compared to other psychiatric medications, SSRIs have been proven to be safer and to have fewer side effects, but that does not mean that they're void of any. When you first open your package, you'll find a very long prospectus, which, especially if you're taking it for anxiety, can be especially scary. There are certain side effects which, if you start taking the medication and you experience them, you should visit a doctor right away. These will be covered in detail in the prospect, and I don't really want to cover them here because I don't want to scare people, but essentially, if you have signs of serotonin syndrome or of an allergic reaction, you should go to a doctor. There is also the black box of suicidal ideation, which is in most antidepressant prospectuses. It basically means there is a chance that you may have the urge to commit suicide or have suicidal thoughts when initiating the antidepressants. And if you experience any of those, then please seek help immediately. And this one might sound a bit weird, but if you feel extremely happy within a few days of starting to take the medication, then you should really follow that up, because it could be the sign of a manic phase or hypomanic phase, which means that this choice of antidepressant is not the best one for what you're suffering from. So serious side effects aside, you may wonder, well, how long will it take for them to work and won't they make me happy? So the answer to that is, annoyingly, SSRIs take quite some time to start to make an effect. They build up slowly in your blood, so you take the dosage every day, but you may not actually notice beneficial effects until at least 3 to 4 weeks in. And if you're taking it for OCD, then it's likely that they might want to take you up to a higher dose, which means that first of all you have to stabilise at the first dose and then increase it, so it may be even longer. This can be quite annoying. The other thing is that when you first start taking them, it tends to make things worse before they get better. However, once they take an effect, they can be very helpful, and they will help with the anxiety and the depression that most people experience. The other downside, the side effects. So I'm going to classify the side effects between the ones that you will probably experience at the beginning, or when you've increased the dose and adjusting to it. It's quite common for extra side effects to occur then, as your body is becoming accustomed to it. And then after that, there are also some residual side effects that tend to disappear after the medication is discontinued. An example of these side effects, which you may experience at the very start, can range from things such as dizziness, nausea, either a big increase or a loss of appetite. You may see things slightly blurrier, you may get a dry mouth at night, you may sweat. Basically, there is a very long list here of what could happen. Fortunately, most of the first side effects will disappear after a while. There are also some mental side effects as well. Your depression and or anxiety is likely to rocket during the first few days, and that is why it's recommendable, A, to make sure you're seeing your doctor frequently so they can check whether these side effects are normal or whether maybe there's a medication that would be better for you, but also tell someone who's close to you, because then they can keep an eye and make sure you're all right and remind you that it's probably the medication and not what is underlying. So it's very important to have support during those first few weeks. In the long term, once the medication is stabilised, ideally most of these horrible side effects will have vanished, and if they are still there, then you may consider switching to a different SSRI, because different people react to them in different ways, and as far as I know, no one knows how to predict beforehand which one is the best one to take. So once they're stabilised, there are a few side effects which I think are quite common and which people should know about. One of them is it will affect your appetite. It may increase your appetite or decrease it, so that's likely to be associated with changes in weight as well. It is also common for it to have sexual side effects, so some people report anorgasmia, which is the inability to reach orgasm, or they may have a delayed orgasm, so it's much harder to get there. And in men, there could be problems of erectile dysfunction or inability to ejaculate. And these are certainly all valid side effects to go to your GP and bring them up and see whether a dose adjustment is necessary or whether there is something else you can take instead to help. Another one that people complain of is changes in sleep patterns. So you may feel very exhausted, or that you need to sleep more, or conversely you may feel that you can't get to sleep at night, and this also may affect your sleep patterns. So this is also something to bear in mind. Again, people respond differently, and ultimately it is your call whether the benefits that the SSRIs give you are worth the side effects. Fortunately, in almost all cases, once you discontinue the medication eventually, all of these side effects disappear as well. The other thing about SSRIs is that you're likely to be in them for a relatively long term, provided nothing terrible has gone wrong that means you have to come off them. I was told I should wait until I was better plus 6 months, so that's easily within the ballpark of quite a few months, maybe even a few years. Some people are on them for very long term, so again, this is highly individual. But it does mean that when you come off, you can't just stop cold turkey, you need to taper off this medication, which means gradually decreasing the dose, so your brain adjusts to this change in medication. If this process is done too quickly, then you can expect to experience withdrawal symptoms, which are very similar but different to the symptoms you may experience at the beginning when adjusting to your dose. Therefore, either switching to a long half-life SSRI such as fluoxetine, which stays in the body for a much longer period of time, or doing very gradual tapers means that when you do eventually come off the medication, you're much less likely to experience these side effects, or to experience them but at a much lower level. So you may wonder then, what if things don't work out? How do I know if they're not working out? Again, big disclaimer in case you've not got it already, I am not a professional, this is based on my experiences and what people have told me. Therefore, this is certainly something that you should be definitely talking about with your doctor. They will know what is normal, what isn't. If you find that you're experiencing lots of side effects still, and you think that if you could go on a medication that had fewer ones, then it may be better. They may switch you to different SSRIs. Here's a small table of SSRIs which are currently licensed for OCD. It actually varies between countries. I know the US has some that the UK doesn't. And they all have different characteristics in terms of how specific they are, their half-life, and also the side effects which are most commonly associated with them, although it also varies greatly between people. So it may be beneficial to switch from one SSRI to another, and this is something which your doctor will know the most about. So unfortunately, in some cases, it does happen that SSRIs simply aren't the best option for people. Either, even at the highest dose, they still don't have the required effect, or the side effects that come alongside it are too much for the person. So in that case, you should talk to your doctor. There are other classes of medication available for treating anxiety and OCD, so they will most likely look into that, and it is also possible to have a combined treatment where you combine different sorts of medication in very specific doses, which have been found to be helpful for OCD as well as other conditions. So I wouldn't despair if they don't work. Obviously it's lost time, it's painful, it costs money, but it doesn't mean that there isn't any hope. There are other options available, as well as CBT and ERP. So anyway, I think I've covered everything in brief that I wanted to say about SSRIs. Essentially, talk to your doctor a lot, Make sure for bad side effects, and definitely talk to your doctor if they're bothering you, expect things to get worse before they get better at the beginning, especially in terms of side effects, both mental and physical. After a few weeks, the beneficial effects will start to kick in and your condition will stabilise, although you will probably experience some side effects to a low level, and these will probably spike whenever you need to adjust or increase your dose because your brain needs to get used to it, as well as your body. So yeah, there are multiple types available, so if one doesn't work for you, you can switch to another one. And if SSRIs in general don't work, there are also other classes of medication which have been approved for the use with OCD. Thank you very much for watching me today. I hope this was helpful to you on some level. Please let me know if there's anything else you think I've missed out or anything else you would like to know. I have a part 3 and a part 4 on the way, and this is expandable to part 5s and part 6s. Subscribe if you would like to see more videos relating to OCD and Tourette's, because I make lots of videos about them. And of course, if you have any questions or there's anything you want to comment, then please don't hesitate, because I love hearing from everybody. I hope to see you in the next one. Bye!